If you're considering dental implants, you want to know your dental implants will be planned and placed by an expert who knows how to give you the most appropriate treatment for your circumstances. Dr. Nitash Patel completed a prosthetics fellowship at the University of Florida, which focused on complex cases, including full mouth reconstructions, implant-related restorations, prosthetic treatment for cancer patients, correction of cleft palates, and complex cosmetic makeovers. He has completed over 1,000 dental implant placements and restorations over the last 10 years. Today, he teaches and mentors other dentists through the Dental Implant Institute of Tampa. Listen as Dr. Patel tells us in his own words about his personal journey in dentistry.
The good thing about implant dentistry is it's very successful. In comparison to a lot of things we do in dentistry, root canals, crown and bridge work, we find that implants actually have a higher success rate. Usually about a 99% success rate is what statistics show. So it really has become a situation where that should not even be a factor in the patient's mind of whether there should be success or not. There's obviously some patients where they become a lesser candidate if a patient is a smoker, uncontrolled diabetes, things like that. But for a healthy patient, trying to get ideal work done, it should be the only option. The benefits we see with implant dentistry is we're not only restoring that particular site, but we're actually stopping the progression of other issues. Lots of times when patients start losing teeth or they start wearing partial dentures, instead of helping the patient, we're actually slowing down. We're actually creating a situation where they can actually cause more problems with the other teeth. Cutting down teeth for the purpose of a bridge, or placing a partial denture that causes food impaction and causes stress on other teeth. All of these things become eliminated when we start going into the realms of implant dentistry. And we see that we get to a point where patients are at a stable point instead of slowly progressing into more and more dentistry over the years. So in actuality, many patients end up spending a lot less money, a lot less time in the dental office when they choose the right options. We've seen quite a few things. First of all, I would say the thing that I feel does the biggest improvement for patients is simple treatment, 2 implants for an overdenture. Compared to anything else we do in dentistry, that changes people's lives dramatically. We have plenty of patients who come in with lower dentures who have complaints about not being able to eat a lot of foods, having sticky adhesive become slippery every time they eat or drink anything. Here in Florida especially, we tell our patients you need to constantly be drinking water, stay hydrated. And our denture wearers have a tendency not to drink water throughout the day because as soon as they have that sip of water, that sticky adhesive becomes slippery. And they got to go through that whole process of cleaning out and reapplying adhesive. Well, as soon as they get into the implants and have that denture lock in place, they're able to eat anything they want to eat, they can drink anytime they want to drink, and it affects their quality of life, it affects their health, digestion, their hydration. It's probably the best thing a patient can do if they're in a denture.
At Serenity Dental of Tampa, Florida, dental implant consultations are free of charge. We want you to be fully informed and comfortable before making a treatment decision. Dr. Patel will be happy to evaluate your circumstances, recommend treatment options, and answer your questions. Schedule your free consultation appointment today.